This is the Debrief Podcast from FingerLakes1.com. I'm Ted Baker, joined by Josh Durso. Good morning.
Good morning.
In day what of post-COVID quarantine?
I guess I am officially like day 3 of post-quarantine life.
So now it's not just a news story, it's life. So give us the timeline, and what did you learn, and what lessons can the governor and the president and Walensky and Fauci and all the rest of them learn from this?
So I think the big takeaway for me personally was just sort of seeing the lag between positive test, reporting positive test, and when the contact tracers actually got around to getting a hold of my wife and I, who both tested positive.
I didn't even know they were still doing that.
Oh yeah, they're still doing it. And then also the wildly different instruction and feedback that my wife and I, got from contact tracers. Now, obviously, we live in Monroe County, so different ball game. We're dealing with a different population base, I guess, because what seems to be happening is you have local health department workers who are doing contact tracing, and then you have the state surplus workers who I believe are stationed downstate and calling and doing some of the contact tracing as well. And from what I gathered, the individual that called me when I had my contact tracing phone call, which came, like I said, 4 days after positive test was reported, that individual was very cautious about instruction, very vague about instruction, and used the word recommendation to describe isolation, to describe quarantining, to describe the steps I should be taking, whereas the individual that my wife spoke with offered very specific local guidance. And when I actually asked the contact tracer that I was on the phone with what the protocol was based on work situation and things like that, the person defaulted to, well, you should talk to your employer about what isolation protocol you should follow, which I thought was just an incredibly stark contrast to what we've been hearing from public health officials, which is that you need to listen to the health officials about what to do if you test positive for COVID. Clearly, that's not how it's happening. But now the flip side of that is my wife, who's a healthcare worker and obviously subject to a whole different array of rules and regulations around isolation, she was painted a much more detailed picture when she spoke with the contact tracer. So it's this discrepancy. And then to follow that up, the guidance actually changed. Monroe County's guidance actually changed 3 days into our actual isolation. So it was a very bizarre set of circumstances to go through. They began our isolation when our symptoms first began, which wound up being basically right before the Christmas weekend, even though we didn't test positive for several days after that. And then the most interesting personal part of this whole process was my first positive test was in the middle of the week on a Wednesday, and less than 72 hours later, I was testing negative and have tested negative every day since. So it is quite an interesting dichotomy of where we stand right now and how nuanced this variant is. Now, I will say, for me personally, and for my wife, who's vaccinated and boosted, it was not coronavirus 1.0 for sure. Now, we have friends and family members who were hit a lot harder with this variant, who had a just as serious an experience as was what a lot of people were dealing with in year 1 of the pandemic. So, it's that back and forth. It's a very individualistic thing. And I would also say that if there's a lesson to be learned, if the local, state, and, who knows, Dr. Fauci is listening right now, my suggestion would be to get everybody on the same page, because it turns into this guessing game. And I don't think we want employers being the ones to make final decisions on how long people should be quarantining. I'm reasonably sure that most people don't want that to happen. I'm guessing the 7-Eleven manager will say, just come on in. Yeah, and I think that's probably what's happening. And I would also say that at this point, and this is just kind of doing some very anecdotal analysis in our friends group and in our circles, and seeing the feedback that I'm seeing online from different folks, I would say that a pretty big portion of spread of Omicron, because of how easily it does spread, is happening now because of this mixed messaging and people ultimately going back out into the wild sooner than they probably should.
Well, so here's my first question, because I expressed the surprise that they're still doing contact tracing. If this variant is so aggressive that practically everybody's going to get it, and most people are going to get it in a mild form, is that worth the effort? Is it worth the effort still to go through this contact tracing, especially when by the time a lot of the phone calls get made, you're already testing negative, and it's really kind of a moot point?
So I actually didn't think we were going to get... So Monroe County is one of the counties that has an online portal where if you take an at-home test and you test positive, you can just submit your result online, and it's an automated process. When we did that, we received an automated email that basically, in very vague terms, said, isolate, go do the things that you've been told to do a billion times if you test positive. I didn't think there was going to be a contact tracing call, especially once we got to day 2 or 3 of isolation. Day 4 is when that phone call, I believe, actually wound up coming. So, it's kind of, a too late scenario at that point. And also, I'll say this, without having, and I'm not saying a lot of people will get that when they get that order from the Department of Health to isolate, that thing that everybody kind of joked about over the last couple of years, because it reads kind of like a criminal order in that sense. I'm not sure, absent that, I'm not so sure people follow the isolation guidelines right off the bat if they don't feel really sick. And again, it just goes back to this point where I'm not really sure the mitigation steps that a lot of people think are being taken are actually being taken. I kind of think it's being missed.
Which leads to our next point, which is dueling guidance. The CDC recently revised its guidance to 5 days. They said essentially, and I may get this wrong, I believe it's 1 to 2 days on one side and 2 to 3 on the other that most people are contagious. I don't remember if it's 1 to 2 after or 1 to 2 before, but they came out with the guidance 5 days. Immediately, several county health departments, including Monroe at the time, said, oh, no, we're still doing 10 days. So we have over here, remember this name, the Centers for Disease Control and Prevention. Here's an agency whose entire existence is to control and prevent disease. Over here, on the other hand, we have county health departments saying no. What kind of system is this? And then not only do we have the CDC, but then we have the NIH, which is Dr. Fauci's agency. So an idea that I had to, I don't know if you're before your time possibly, but the old Nilsson song back in the 70s, everyone's talking at me, I don't hear a word they're saying. There's too many people talking right now. We need a single voice that says these are the guidelines, this is the latest science. We can't have county health departments running around telling people no, so that Joe average residents out there going, it's 5 days, no, it's 10, no, it's 7.5. The messaging fails yet again. We're 22, 23 months in, and they can't get the messaging right.
Well, and in taking that a step further, my wife works in healthcare, and the number of folks in her circle who literally have no clue what the actual guidance is, or where the guidance is local or state, or if they're following CDC or whatever the case may be. And one other, listen, my biggest gripe with everything that I've encountered in the last, what is now like 2 weeks, is this. You go through all of this contact tracing. You go through all of the phone calls, you isolate, you do all the things you're supposed to do. And if you go to the State Department of Health website, there is a 2-page document that essentially outlines what the state deems as essential work. When I say it's the book of exceptions, it is the book of exceptions. It's hard to find a profession that isn't included, to the end that, like, if you work for a business that has a government contract of any kind, you are deemed essential, and you can exit quarantine at the earliest stage. Now, assuming you don't have symptoms, and there's this whole debate about, whether you can even recognize whether you have legitimate symptoms or not. The state actually tries to define what significant symptoms are, which is another judgment call and guessing game. Having that documentation out there in the ether while you have state and local officials making general statements about something that's very complicated is terrible, because it just adds to the confusion. Like I said, healthcare workers aren't even sure what the rules are. So I think there needs to be like a single message. I don't think it should come from the CDC. I think the CDC is making its decisions based on economic pressures, and I don't necessarily agree with the idea of entrusting that body to make good single-layered decisions. That said, the state should definitely be that body. Counties shouldn't be going rogue from what the state ultimately decides, or they shouldn't be able to, like, you shouldn't, because the comeback to that is going to be, well, the state says it's still 10 days. The state hasn't moved to CDC guidance yet. Inevitably they will, and inevitably there will be counties that do different things. But that said, you've also got people who live in, I'll say, more rural and lax counties throughout the region, which, just like the mask mandate, are getting more general, more vague isolation instruction. And how do you think that's being interpreted? And how do you think that's playing out? You do, as you described, have this scenario where a dozen people in a dozen different places have a dozen different outcomes, and it just doesn't make any sense.
I am generally not a believer in big central government, but in this case, I think I'm going to disagree with you. And this is a national problem. I don't think we can have 50 states or 50 states and 1,000 counties making these decisions. I think that somebody at the top has to do it. But then, like I said, even at the top, you've got Dr. Walensky, you've got Dr. Fauci. Frankly, they're probably both terrific medical professionals doing the best they can. In my own opinion, I think Dr. Fauci has become a little bit too fond of the camera and the microphone. I think he likes being the go-to guy for quotes every day. And I sometimes question some of the motivation that's driving some of these decisions.
Yeah, and I also think it's very difficult, to your point, I'll help it along here. I think it's very difficult for one state to make one decision if another state is just going to have a different set of rules. Because then you start to get into a scenario where you've got people living on the border who are, confused about messaging. And yes, that does make things more
right. I mean, we had that in the very early days of the pandemic with travel bans between
right.
states, and one state's going to punish another, and we're going to, Rhode Island was going to ban New Yorkers, and New York was going to retaliate and ban Rhode Islanders, all 14 of them.
Yeah. So I don't necessarily know that there's, I have to kind of take this a step further. I have absolutely no hope that there is going to be unified messaging on this front. I think now, especially with the numbers that we've seen from the Christmas surge, or from the Christmas spike in confirmed cases in New York, I think there's probably at some point in the next week or so going to be another jump in cases from New Year's. Obviously, 3, 4, 5, 6 day lag in reporting. I don't see a scenario where any more intense restrictions come down, and I don't see a scenario where the plan isn't anything other than just weather the storm right now, and in a few months, this will probably be a bit of a memory.
Well, exactly, and that's exactly where I was going to go next. If this variant is so virulent that it gets almost everybody, at some point it's going to run out of hosts. I mean, isn't there reason to believe that this is going to burn itself out sooner than later, and that by next spring, I mean, if you look at last year, you look at the numbers and look at the deaths, it spiked real big in the winter in January, February, and then when we got to warm weather, it was back down to nothing. I mean, is it reasonable to think, I don't know what the positive test percentage is around New York these days, 10, 12, 15, something like that? I can't even
22%.
Is it that high now?
It's been between 22 and 24 for about the last week.
Is there reason to believe, or let me put it this way, is there any reason not to believe that by next June it'll be 0.2 again?
Yes, but I think this is going to be very seasonal, and here's why. This was not my first go around in quarantine or isolation. So
right.
last year, right at the same time, right after Christmas, my wife tested positive for COVID 1.0, we'll call it. So we spent the next 10 days in isolation and quarantine, and fast forward a year, and we both tested positive again. So I think this is going to be something where there's the risk every single month, or every single winter, rather, that we see a spike in this, much in the way that we see flu cases rise and things like that. Again, I don't know if we're necessarily going to get into this today or not, but I think this is a very good reason that we need to have a healthcare system that is more robust and more able to handle a sicker population. We aren't going to see COVID zero. COVID zero is never going to happen. So if you're one of those people who wants to see that or believes that's possible, you're living in a fantasy land. It's never going to happen.
I tend to agree with that at this point, and and we won't get into this in depth, but just quickly, do we need to shift the approach? I think there's still a lot of people with the idea of eradicating COVID. Do we need to begin to think of it more as the flu and deal with it rather than trying to wipe it off the face of the earth?
I've seen two things. I've seen reporting that some of the polls or pollsters are actually testing that messaging for this upcoming midterm election cycle to see basically if this is something that people are willing to live with and if Democrats can actually run on that platform. And secondly, I don't think we have any evidence to suggest that that isn't exactly what's playing out. You have Governor Hochul, in the notes that we were exchanging before the show, Governor Hochul has been taking it from every direction. She has just been getting crushed from the left, from the right. She's not coming down with harsh enough economic restrictions. There are a lot of people on the progressive left who want to see in-person dining and bars shut down until this surge is over. People who want to see basically guaranteed work from home and things like that. And Governor Hochul, as recently as just a couple weeks ago, was tweeting about how people need to get back into the office ASAP. So I think that, for a lack of a better term, politicians are moving on, even the ones on the left. And despite that, she's still getting hit pretty hard from folks on the right who say, this is basically just a dictatorship in New York and end the chaos and end the mandates and this, that, and the other thing. I think when we really take stock of what we have right now, we don't have any harsh mandates in place. The mask mandate is not really a mandate, as we've talked about on the show before. There is no vaccine mandate in real common life, other than in places where you have public healthcare workers in play. And it doesn't really seem like anything more significant than that is going to come, because I'm not sure the state is really capable of implementing it. So to answer your question in a really roundabout way, I think we've moved on. I think that the politicians have moved on, and what we're going to see over the next several weeks is kind of a jockeying of that position to make it sound like there's a lot of concern and angst perhaps about the rising COVID numbers, positive tests, but maybe not in real policy. Maybe not in real policy in terms of what we see. I mean, the governor did just request that hospitals begin reporting incidental hospitalizations,
right?
Which I think is a step, to say that again, that is a step toward the right if we're talking about what policy or who wants to see what kinds of policy. That's not a step to the left. So, I think that is a pretty good tell in terms of where we're going.
There are so many different directions we can go on this. I think, are we both in agreement? I don't think we're going to see shutdown 2.0.
Oh, no.
I don't believe the public would tolerate
no shot.
Left, right. So I don't think we're going back to drive up, take out food anytime soon.
No.
And then recently, it was a couple of weeks ago, Ontario County held sort of a state of COVID news conference. County officials were there.
Yep.
Some of the heads of the hospitals were there. Senator Helming was there, and one of the things that she's been talking about a lot is changing the emphasis from vaccination to basically what they call test out, for example, in schools.
Yep.
Or for that matter, for healthcare workers. I mean, a lot of people have been critical of the vaccine mandate for healthcare workers because it's driven the staff numbers down. Would we be better off if people could test out? You take a test. If you're positive, you turn around and go home. If you're not, you come to work, vaccinated or not.
Perhaps, but I think it gets complicated because some people will some people will not test negative for months after they're infected, which would create a new burden and a new problem. I think, again, this.
But I mean, it's not perfect, but it's going to screen out the majority of people when they're positive, isn't it?
It would in theory, but you'd probably have to couple that with symptoms or whether there is a presence of symptoms or not. And again, it's getting into this scenario where it's a very complex solution to a problem that probably needs to be dealt with in the most simplistic way possible. And I will say this, like, I understand there's a lot of frustration with the mandate on healthcare workers to get vaccinated. But guess what? It was the easiest solution to a problem that the state tried to fix, and it wasn't perfect. I doubt if the cards were dealt again, I doubt the state would go that route again. But I think that was just kind of a reality of where we were last fall. And in trying to avoid this, it happened anyway. We had a surge because people are at home exchanging the virus,
right?
Not when they're at the gym, not when they're at the grocery store. That's an
any
issue.
Airborne virus is going to pick up in the winter in the Northeast. The days are shorter, the weather's colder, we're inside more. One more thing before we move on. I had an opportunity, I'll try to be quick here, to sort of observe a slice of healthcare 2022 yesterday. I had a loved one who had a situation that needed to be addressed that day. It was not life-threatening. Her primary care physician would not take her because she had never been treated by the physician yet. It's a new relationship. So because of that, you're penalized apparently for being healthy. No, we can't see you. She walked up the street to one of the nearby urgent cares. No, we can't take you. Now, I don't know why that is, because the whole point of urgent care is no appointment, walk in. It's supposed to be for things between make an appointment with your doctor 3 days from now and, oh my God, I need treatment immediately. So that's out. She called another urgent care. No, we can't treat you for that. You've got to go to the ER. We go to the ER. 6.5 hours later, we're out. These people are tremendously overworked. And the impression I got was that it's more of a staffing shortage than it is a bed shortage. Yeah. And I will say one more thing, and this goes for not only dealing with healthcare workers, waiters, waitresses, forward-facing, public-dealing people. Don't take it out on them. There was a family came in that just got very irate after a 45-minute wait because their teenage son, who didn't appear to have anything terribly serious, hadn't been seen yet, and other people had. And there's a guy trying to explain, this isn't Denny's. We don't see you in the order you come in. We see you in the order of the seriousness of your condition. And there may be somebody back there who came in 3 hours ago on the ambulance, and we're still trying to keep them alive. And we'll get to your son. So please, just don't take it out on those people. I mean, I talked to a young nurse in the ER, and she said, they come this close to wanting to quit every other day. And then she says, so then someone like you, a nice family, comes along. They kept apologizing. I said, do what you got to do. Yeah. If we have to wait, we have to wait. We understand.
Well, and to that end, urgent care centers are no different. We have friends who work at multiple throughout the region, and one of the things that we hear all the time is that they're just as short-staffed and they're just as up against the wall as any of the hospitals are.
But what I don't understand is I thought they were basically walk-in. So when they say we can't take you, does that mean they already have all the people they can handle for a whole day at 12 o'clock noon, or they just? I don't understand.
So what ends up happening now, what
the jam up was
in a lot of cases, and I'm speaking kind of out of context here, but essentially what happens is the day has X number of slots. So an urgent care has the capacity, because there's only so many providers on, to see, say, 60 people through the course of the day. That's a bad number, but just use it for the hell of it.
Example.
That they may hit that 60 threshold by 9:30 or 10 in the morning.
Okay.
In terms of, so what they're doing in a lot of cases is someone walks in and they say, I need a COVID test. I don't feel good. They say, okay, well, we can't test you right now, but you can come back at 1:30.
Okay.
And that's exactly how that plays out. And that's how one chain urgent care center system that I'm not going to name deals with it. But that's how I would imagine a lot of them deal with it. And we've heard stories of these places hitting their capacity within like 30 to 40 minutes of opening.
Okay, that makes sense.
So,
I can understand that.
But to your point, it's a capacity issue. It's a capacity issue. We keep coming back to this. It's a capacity and body issue.
But again, I believe much more a staff issue than a bed issue. I
Sure.
think that if somebody needs a bed, for the most part, they can still find it. And I don't want to get into all the math here today. One more thing just before we move on here, so we're not doing all medicine and COVID all day. And just a thought, we don't have to discuss it today, but why isn't there a massive push in New York and nationally to steer people into healthcare careers? I mean, you can get educated, at least on a basic level, pretty quickly. I mean, Finger Lakes Health has their College of Nursing. There's a definite severe need for healthcare workers, and it seems to me right now that we should be trying to convince a lot of high school seniors to get trained, grab their scrubs, and get in there and start getting after it.
Yeah, I think that's a tough sell now with the way a lot of those things are discussed, especially on social media.
All right, so number 2, bail reform.
Yes.
We have both, I think, been a little bit skeptical of the ruckus raised by politicians on the right and some in law enforcement about how many people, I mean, to hear some people tell it, people are just being let go willy-nilly and committing 5 more crimes the same day. You got some feedback on a story that you published with some numbers, and you've done some digging and have now come to a little bit better understanding of the issue. So enlighten me.
So the data here's the gist of the data. 5% of people who were released on bail reform committed violent felonies after the fact. That was the headline from that particular data set that came out of New York City, which was issue number 1 in my mind. But so let's talk about why that data might have been a little misleading. Essentially, there are 2 pools of people. Pool number 1, people who are arrested on qualifying felony offenses. These are the bail-eligible individuals. Pool number 2, people who are arrested on misdemeanor or lower charges who are not bail-eligible and are just released on their own recognizance. We see plenty of those press releases every day.
That's the vast majority of what we report on all the time.
The criticism of the data basically hinges on the perception that these 2 groups are one and the same. They're not. The bail reform data that we published showed 5% of the people who are arrested on those qualifying offenses from pool number 1 are rearrested. But the feedback that I got from folks in law enforcement was that an overwhelming majority of people who are arrested in pool number 2, the lower level offenses, and are released on their own recognizance, they're the ones that are recommitting crimes over and over and over again and not actually being held as they previously could have or should have been. That is the gist, and totally anecdotally, but some of the feedback that we've gotten suggests that the numbers would be pretty significant in terms of that percentage of pool number 2 who is recommitting crimes. What does that mean? So that means you have a lot of people who are getting arrested for, say, domestic incidents, being re-released and then violating court orders and things like that. Again, we see that all the time, and it's anecdotal.
But I mean, didn't that happen before bail reform? I mean, that to me, that's not an issue that changed with bail reform.
It did. So what I've been learning now is that the issues that law enforcement have isn't necessarily with bail reform or how that's breaking down. They actually think, the ones that I spoke with actually think the numbers are probably about on with that pool number 1 figure. The issue is the assumption that the 2 groups are lumped together and that it's all the same. It's not. And what a lot of folks in law enforcement are saying is that there needs to be a better fix to the pool number 2 problem that exists, and in addressing that those folks aren't just re-released into oblivion to continue recommitting or whatever the case may be, getting arrested over and over again, or just not appearing at all.
Because here's a number I saw. This was a few months back, and I don't remember the source. I apologize. And how credible it was. I recall it as being a relatively credible source. It said that before bail reform, 76% of people arrested were let go for one reason or other, and that after bail reform, the number went to 91%, which basically means, if you do the math, that 6 out of every 7 people are treated exactly the same now as they were before bail reform.
Yes.
So I don't know, and maybe I'm wrong here. It seems a little difficult to believe that 1 out of 7 people are just wildly running around committing crimes. Maybe they are. I don't know. If I'm wrong, I'm wrong.
So I think two things that come to mind. One is the way it was essentially explained to me is the 5% figure. It's almost like taking 5% of 5% of all the people who are arrested. So it's a very, very small number. The issue is with that other 95% of people who are arrested, which is sort of the low-level charge stuff. And I also think what I'm gathering now is that there's a pretty big difference between what boots on the ground law enforcement think about this problem and the way that we see certain elected officials
I agree with that completely.
So I think that's probably the big difference. If you're just going by what the political talking heads are saying or what elected officials are saying about bail reform or about the effectiveness of it or how it's impacting the way law enforcement does their job on a daily basis, it isn't really how people who work in law enforcement necessarily feel about it.
I think you're right. And let's face it, crime has been an issue that the right has used against the left politically for years.
Right. And this is really just an extension of that.
And what I remember, I remember a while back reading the list of offenses for which people could no longer qualify for bail. And it seems to me that a fix wouldn't be real hard here, I don't think. It seems to me that I think the idea behind bail reform was a good one. It overwhelmingly punishes the poor for relatively minor offenses too many times. But I think they went too far with it, and I think there are some offenses that you look at and you say, somebody shouldn't be able to just walk when they commit this offense. I mean, it seems to me that they could make just a small change, making some of the worst offenses back eligible for bail, and that would take a significant bite out of this problem. I've got a scheduled podcast with Sheriff Brian Skank from Cayuga County coming up, I think, next week. And so we'll get into some of these issues with him when we do that.
Yeah, I think, again, it's the difference between what the qualifying offenses are and the volume of people who are arrested for those qualifying offenses. It's a microscopic number in terms of the total population and how many people are arrested in total over the course of a year. And when you have, on either side, these numbers being touted, especially when they're percentages, only 5% of 5% were committed a violent felony after being charged with a violent felony. Okay, well that is not necessarily the piece of evidence that turns into the smoking gun that I think a lot of people on the left wanted it to be.
And frankly, repeat criminals, I think, have always committed the vast majority of crimes anyway. I mean, it's the 80-20 rule. Probably 20% of crooks commit 80% of the crimes. Next up, last person out of Geneva City Hall, turn off the lights. First Sage Girling, now Adam Blowers. What's it mean?
I don't really know. Like, this is, so you've got city manager, assistant city manager, you've got a sixth ward councilor, all of which are now heading towards vacancy, and a city council that seems not really that well equipped to deal with anything that requires taking decisive action. So I'm genuinely curious how this is going to happen. I think the biggest concern for residents at this point is what happens to day-to-day management. Does that fall, because when there was a vacancy before, if you recall, when Matt Horn left, there was a national search that took place, and during that time, there were 3 individuals who were appointed to the post to kind of share the responsibility. But before that, the day-to-day went to the mayor, I believe. And I think that's kind of where you would be at this point. It just raises a lot of questions, because now the chaos that was previously contained to city council could potentially infect the rest of City Hall. Some people might argue that it already has, but now would definitely be more likely to happen moving forward until that vacancy is filled. And I cannot imagine how long it will take to fill that vacancy. That is probably going to take, I would say, in the best case scenario, months, summertime, before you see a city manager appointed in Geneva.
Does the city look for somebody with that kind of experience that can step in and do at least some of the work on a part-time basis, maybe share it with the mayor?
I don't think City Council will be able to presently agree on a path forward, which creates problem number one. Problem number two is agreeing on a candidate. I don't think that's going to be very easy to do. Problem number three is attracting someone who I think doesn't make a lot of decisions, because ultimately I think that's what this city council is going to want, someone that allows city council to continue making a lot of day-to-day decisions. So I'm not sure. I'm not sure what that is going to mean for the city. Jackie Augustine is going to be in one of these next 2 weeks here on the show, and we'll certainly be talking about
She'll
this
have some
more.
Opinions.
Certain of that.
So here's my next question. For the Geneva City Council, which is worse, its inexperience or the divisiveness?
I think
both.
I think both. Although the experience argument is kind of starting to go by the wayside, right? Because they've been in for a couple of years now. You've got a handful of counselors who aren't new. This isn't their first rodeo. So I think the experience was a good excuse in year one. Now I don't think so. I think that the chaos is kind of starting to rule the day, and I think that's a pretty big concern for this city council, especially since they have to attract someone who wants to fill a vacancy on that council before they do anything else in theory. So it's a challenge. Clearly.
I don't have any great insight into the various factions and disputes on the council, but is that why these two city leaders left? Are they tired of the left-right fight, and you have two sides like nationally and increasingly in a lot of levels of government can't agree on what to order for lunch? I mean, they just can't come together on anything.
I think back to and I like you don't have a lot of insight to this specific situation, but I will say that dating back to the time when I years ago now covered the Seneca County Board of Supervisors, over the years when there was a lot of turnover in the county manager's office there, you had this sort of revolving door situation over the course of 6 to 8 years. I think when you have a governing body that likes to make a lot of decisions and likes to micromanage, I'm not saying that's good or bad, I think it's difficult to keep a manager who is an employee that you're tasking with running that municipality 28 or 30 days out of the month.
Because that person doesn't want to be a politician. They don't want to be in the middle of a left-right. They want to be looking at
it may not be
plans.
It may not be right-left. I mean, to kind of debunk that a little bit, I mean, using Seneca County as an example, it's water and sewer. It's truly local stuff that winds up getting very murky. But if you have personalities on a governing body that like to make decisions or want to be at the center of every single decision or want to be a part of every single decision, it gets very difficult for a manager to actually do its job. Perhaps a lot of folks in Geneva might dislike me for saying this, but perhaps the city would be better fit with a mayor who essentially served as the day-to-day runner, the CEO of the community. Maybe that would be a better fit for a community like Geneva. I don't know.
Well, and I mean, we're seeing right now the town of Seneca Falls is discussing a professional town manager to take some of those day-to-day operational things out of the hands of elected politicians that change every couple of years.
Right, because you do maintain institutional knowledge, and that experience issue that you brought up does dissipate a bit if you have that institutional knowledge that is in form of full-time employee. And accountability. It's a lot easier to hold an employee accountable than it is to hold an elected official accountable, because I know the voting booth is the most powerful tool in American democracy, but in small-town elections or even in city elections, if you have the support of the party and you have the support of enough name recognition, I'll say, you're favored, whether you're good, bad, or indifferent.
So speaking of disagreement, the two factions of the Cayuga Indian Nation are at it again. Cayuga Indian Police raiding the pipekeeper's shop, and now guidance. That's what we all want these days. Guidance from the Bureau of Indian Affairs.
Yeah, and that's really where this, and I don't want to get too into the weeds on this particular topic, but you've been around long enough, Ted, to know that this has been going on as long as you've been in the Finger Lakes, right?
One of the first stories I covered at the radio station in 2003 was a meeting of one of the factions or the other. I don't even remember which one.
So you've got this ongoing land issue, land use issue, and the Bureau of Indian Affairs essentially stepped in and said the state and local folks have jurisdiction over the land. Why? Because essentially, and this wasn't spoken, but this is the assumption, the land has not been moved into trust. Their land into trust application, the Cayuga Nations, has not been approved. Actually, Finger Lakes One's reporting from 1.5 years or 2 years ago now was cited in the federal government's last decision to not move the land into trust. Now, there's been a lot of speculation that is going to soon be coming to roost, so to speak, and there will be land into trust granted. But until that happens, it's just land owned by the Cayuga Nation. It's not sovereign property in the traditional sense. Now, they will contest the opposite because that's the angle they're coming from. But why do we keep having all of these little incidental debates and things like that come up, or even property being raided and things like that, and this gray area where law enforcement is either not engaged enough or too engaged or trying to walk this fine line? Because there isn't a decision being made at the federal level. A decision at the federal level ends all of it, fixes all of it. It's over. Like, as soon as the federal government steps in and makes a decision, there will at least be something concrete in black and white that everyone else can essentially point to and say, well, this is what was actually said and done. We don't have that. We haven't had that for nearly 30 years now, and this is the result of it.
So why don't we? There are Oklahoma, for example, has lots of Indian tribes and nations. In fact, there's a Cayuga tribe of Oklahoma. Other, Midwestern states, the Dakotas have reservations, have Indian land. Seemingly all these issues were settled a long time ago. Why is it different here in upstate New York?
It seems to be because there's this very intricate balancing act being played between the federal and the state government. I'm curious if actually seeing Andrew Cuomo exit state politics will lead the federal government to make a decision eventually, because this discussion about the land into trust application being renewed or lifted back up again didn't really crop up until Cuomo was out of office. When he was in office, the state did very little and wanted very little to do with getting involved, mostly because the federal government has been kind of just sidestepping the state, and the state has been kind of just standing just far enough away where the federal government hasn't wanted to make a decision. Now it's kind of at a tipping point. What are you going to do? There's a decision has to come, and I hope probably within the next year a decision will come. But there's no guarantee that it does, which makes this so absolutely chaotic.
And of course the other thing is the factional difference. If Clint Halftown is the recognized leader, then shouldn't somebody somewhere tell the other faction to sit down, shut up, go away? It's been decided. Or that's at the heart of all of these day-to-day stories now, is that battle for control and the battle over who's the legitimate Cayuga Nation leader.
Because even that hasn't been really fleshed out fully by the federal government. There is still conflicting reports and indicators about who is the person or persons in actual control or who has proper authority. Again, federal government needs to step in, make a decision, solve this incredibly complicated puzzle.
One of the issues we've been discussing in this program for a long time, economic development. The Albany Times-Union just had a column recently with some opinions and a poll saying that what New Yorkers want more than anything else is economic opportunity.
Interesting, isn't it? Because it basically flies in the face of everything you and I have talked about in terms of what the state is willing to do. The state repeatedly has shown this overwhelming interest in trying to create incentive packages and pit county versus county and region versus region. And this editorial, this opinion essentially just crushed it, just took it apart and, said the best process would be giving power to individuals. and then also dealing with the loss of population. That's something that a lot of these communities, big, small, and medium, are going to have to deal with if they want to do economic development. Because what good is, say, an employer that's going to hire 250 people if those 250 people aren't all unemployed? If they're just pulling from the existing labor force and pulling from small businesses, that's actually just going to hurt the local economy, right?
If only someone in the media had been saying this for the last, 5 years or so. The pilot has turned off the no bragging sign. But but the problem is, as I've said too many times, if I'm an industrial development agency, I need to get credit and headlines showing that I'm doing something. New company builds plant, 200 new jobs is a headline. Little companies expand, each hire one person isn't a headline. I don't get credit for that, and I get criticized, and people say, what am I doing? So I understand. I've said I don't think the way that we do it is right, but we also have to shift that opinion so that people will understand that it's okay for 200 businesses to each hire one new person. That's just as good, and in some cases maybe better than one new plant that hires 200, and just trying to sort of push supply over demand. We've had photonics. Photonics came to Canandaigua. To this day, no one still knows what that is or what they do or why we should care.
Yeah, I think my thought, and I don't know if you agree with this or not, if I were governor tomorrow, my first action would be to end industrial development agencies. Just end them. No more. Quit doing the incentive packages. Quit doing the let's try to get this big giant employer that's going to hire 350 people and just pull from the existing workforce. The data, that energy really should be put in keeping kids that are graduating from high school and college in New York State and in these communities. I don't know if that means investment in entrepreneurial opportunities or investment in specific trainings that are already, fruitful, like healthcare. We talked about that earlier. I don't know, but the thing for me is we've got low unemployment right now, and we also have a lot of job openings. Any announcement that we hear of a big economic development project in the next 12 months, presumably is going to be pulling from an already incredibly tight labor market. So is that a net win for a community, or does that make a problem worse?
Well, if the businesses that are in existence can't find workers, I don't know where the shiny new plant is going to find workers. One of the things that was interesting when I sat in the emergency room for 6 hours yesterday, I was looking at a local publication, and it had 3 ads for industrial-type employers in the Geneva area, paying anywhere from $15 to $24 an hour to start, matching 401k, health insurance, 3 weeks vacation. An 18-year-old coming out of high school today with no real training or skills can make more money than I made for the first 32 years or so of my career. So that was the part of this article I thought was interesting, is people saying we need economic opportunity. If you're a worker, you've got more economic opportunity right now than you've ever had probably in the last century.
Well, and I think that when people talk about economic opportunity, they're talking about the ability to participate in all of the things that the current economy offers. So I think people have kind of lumped that in now with the American dream. Can you buy a house? Can you buy the car? Can you go on vacation with your family? Can you start a family? Can you do any of those things? And I think the answer is, on even those inflated wages now compared to what we saw at the lower levels 2, 3, 4, 5 years ago, it's still not possible, which is why.
Well, and that's where I think that's where our generational difference comes in, because I did it making that kind of money. Even inflation adjusted. Now maybe there's some, we've talked about student loan debt. That's big part of the equation. If you come out of college and you and your spouse both have $200,000 in student loan debt, then you're not going to be able to buy much of anything on $40,000 a year.
Right. And I think the other thing too is a lot of, and I've been guilty of this too in the past, is a lot of folks discount the fact that most 20-somethings aren't two-income households or families.
Right.
And they're thinking about, like, and a lot of, I'm not poking at any generation here, but a lot of older folks that I have this conversation with say, are making this argument from the lens of, well, my wife and I both worked and we both made, say, $25 or $30 or $35,000 a year, and we made it. But they're not thinking about the fact that the 20-something is forced to do that on half because they don't have that second income.
Okay.
And
point taken.
One of the issues that we're seeing play out in the data is that young people are starting families later in life. They're getting married later in life. And that is a huge tell on just how slow people actually are to begin settling down and being able to start to take these steps up the economic ladder because of the economic reality they face when they get out of college. It's not just college debt. College debt is part of the equation, but rent that's $2,000 a month in the suburbs of Rochester is also a part of that problem.
Right.
I mean, that's, we're in a place now where
I must admit, I also saw, I think in that same publication, I was looking at a rental ad, and I was a little bit shocked at what the rent was for the particular description of that apartment. I went, wow, that's 70% more than my mortgage payment on a 2,000 plus square foot house.
And you also have, and some of the best analysis I've seen over the last few years to get into the housing issue a little bit is you have folks who have been renting for years, spending $1,200, $1,300, $1,400, $1,500 a month for years, and then they go to the bank to apply for a mortgage, and they're denied that $800 a month mortgage for seemingly no good reason. They've got the record. They've paid almost twice that for so long, and they are denied the opportunity to own and save money. It just there's so much of it that doesn't make sense.
That's a long discussion for many other days. I mean, we have a broken banking and credit system. I mean, obviously, like you say, when you can't, borrow money when you've shown this record of paying more money. The other thing that this article talked about, and we've talked about many times, shrinking population, particularly school-age population. And, if they can't find workers now, how are they going to find them 20 years from now when school districts that have 1,500 students now are down to 1,100?
Yeah, I mean, this is a problem, that we've seen coming for about 40 years. I remember I tweeted about it yesterday. Over the last 4 decades throughout the Finger Lakes, I did this analysis, I think in 2017 or 2018. I ran through all 65 districts in the Finger Lakes and decade by decade broke out what the academic population was, K through 12, and the decline was absurd. There were only about 3 districts in the entire region that broke even or had seen increases. Victor School District was one of them. That is just a huge problem, and that's not something that's not going away. The problem that we just talked about, young people starting families later in life, that's not a sign that this whole how many kids are our local high schools graduating going to fix anytime soon. So this is something that I'm not sure that I don't know that this is a state problem to fix. I think this is a really big economic problem to fix that probably has to happen at the federal level.
And I think a generational problem, too. I think some of the reason that the younger generation, yours and even younger, are behaving the way they are is less optimism about the system as a whole. Yeah. I think maybe my generation was one of the last ones that just sort of believed in the 25, 40 years, get your gold watch, work for the same company. I think there's a real cynicism and distrust of the whole system on the part of younger people that are causing some of them to say, I really don't want to participate in this.
Yeah, there's no shortage of late-stage capitalism jokes on Twitter in that Gen Z and millennial population. But again, a debate for another day.
And I have had people say, okay, boomer to me on more than one occasion, so I understand that as well. This has been the Debrief Podcast from FingerLakes1.com. Paul Russo is our producer. We appreciate that. And more coming up. I've got a whole bunch of recorded Inside the FLX issues ahead the next few days, so look forward to those. Tonight, I'll be at Palmac High School for some girls' high school basketball on FingerLakes1.com. We'll talk to you then.